Onychomycosis. Fungal infection of the nails. Hello everyone, and welcome to today's lecture. Have you ever noticed thick, discolored, or brittle nails? And wondered what's going on? In this session, we're diving deep into onychomycosis, a common, but often overlooked fungal nail infection. Let's get started. What is onychomycosis? Onychomycosis is a fungal infection of the nail. It often begins with a white or yellow-brown spot under the tip of the nail. As the infection progresses, the nail may discolor further, thicken, and become brittle. In some cases, the nail may also lift away from the nail bed. What are the signs of onychomycosis? It has following signs. Discoloration. The nail may appear white, yellow, or brown. Thickening. The nail may become thicker and harder to trim. Brittleness. The nail edges may become brittle, ragged, or crumbly. Nail lifting. The nail may separate from the nail bed. This phenomena is also known as onycholysis. Distorted shape. The nail may become misshapen or curl up or down. Progression of nail fungus. The fungus can spread from the tip of the nail to the rest of the nail. The nail may become more discolored, thickened, and brittle. In severe cases, the nail may become detached from the nail bed. Important note: while nail fungus can be a nuisance, it is not usually painful in the early stages. However, if left untreated, it can become painful and even affect the surrounding skin. What is the root cause of toenail fungus? The most common cause of onychomycosis is dermatophyte fungal infections. Specifically, Trichophyton rubrum is the most common species responsible for the majority of cases of onychomycosis. Dermatophytes are a type of fungus that thrives on keratin, the protein that makes up nails. They are the primary cause of most onychomycosis, affecting both fingernails and toenails. Other fungi. While dermatophytes are the most common cause, other fungi can also cause it. Yeasts, like Candida, and non-dermatophyte molds can also cause onychomycosis. Non-dermatophyte molds are becoming more prevalent in some regions and are a significant cause in immunocompromised individuals. How does onychomycosis spread to other people? Onychomycosis is contagious and can spread from person to person or through contact with infected surfaces. It spreads by direct contact. Touching an infected nail or skin can spread the fungus. Shared objects. Sharing towels, socks, or nail clippers with someone who has onychomycosis can lead to infection. Environmental contact. Walking barefoot in damp, public areas like showers, locker rooms, or swimming pools can expose you to the fungus. Animal contact. In rare cases, animals can also carry the fungus. What are the risk factors of onychomycosis, toenail fungus? Dermatophyte fungus can be acquired through contact with an infected person or contaminated surfaces, particularly in warm, moist environments like showers, locker rooms, and public swimming pools. Onychomycosis has several risk factors, including athlete's foot. Fungal infections of the feet, athlete's foot, can spread to the nails. Older age. Older individuals are more susceptible to nail fungus. Weakened immune system. Conditions like diabetes or HIV can make it harder to fight off infections. Poor circulation can hinder the body's ability to heal and fight off infections. Certain skin conditions. Psoriasis can increase the risk of nail fungus. How does the fungus enter the nail? The fungus can enter the nail by following ways. Cracks or injuries. Fungi often enter the nail through breaks in the nail or surrounding skin. Walking barefoot in damp areas. Exposure to fungal spores in public areas can lead to infection. Sharing nail clippers or towels can spread infection from person to person. Ill-fitting shoes can cause pressure and damage to the nail, making it more susceptible to infection. How does the fungus develops in the nail? Nail fungus develops when fungi, like dermatophytes, yeasts, and molds, invade and infect the nail bed. These fungi enter through small cuts, or breaks in the skin surrounding the nail. Once inside, they thrive in the warm, moist environment of the nail and surrounding skin, causing nail discoloration, thickening, and distortion. Here's a more detailed look at how nail fungus develops. Fungal invasion. Fungi, particularly dermatophytes, are the most common cause of nail fungus. These fungi can enter the nail through tiny cracks, cuts, or separations in the nail, or surrounding skin. Toenails are more susceptible than fingernails, due to less circulation in the feet, and a warmer, moist environment. Fungal growth and spread. Once inside the nail, fungi feed on keratin, the protein that makes up nails, thus causing them to become discolored, thickened, and distorted. The infection can spread from one nail to others, or from the nail to the surrounding skin. Fungi can also spread from an infected person, or from contact with contaminated surfaces, in places like public showers or swimming pools. What is the gold standard treatment for onychomycosis? Oral antifungal therapy, like in the form of pills, particularly terbinafine or itraconazole, is considered the gold standard for onychomycosis, both in children and adults, because of shorter courses of treatment and higher cure rates. When compared with topical antifungal therapy, like creams, lotions, drops. Why oral antifungals are better than topical antifungal? Studies have shown that oral antifungals, particularly terbinafine, have higher cure rates than topical treatments. Oral antifungals are absorbed into the bloodstream and then deposited into the nail bed, where they can effectively target and kill the fungus. Topical treatments often have difficulty penetrating the thick, hard nail plate, limiting their effectiveness. Elaboration. The most effective treatment for onychomycosis is typically oral antifungal medications, particularly terbinafine or itraconazole. These drugs help the new nail grow free of infection, slowly replacing the infected part. They work by inhibiting the growth of the fungus, allowing the body to grow a new, healthy nail. Oral antifungal therapy generally leads to higher cure rates and shorter treatment periods compared to topical treatments. Topical treatments, while available, are often less effective than oral medications. Can onychomycosis go away without treatment? No, onychomycosis does not typically go away on its own, without treatment. The infection can worsen if left untreated, potentially spreading to other nails, or even to the skin. Without treatment, the infection can advance, leading to thicker, discolored nails, and potentially, separation of the nail from the nail bed. In severe cases, untreated fungal nail infections can spread to the surrounding skin, or even lead to bacterial infections. What happens if onychomycosis is left untreated? Untreated nail fungus can lead to a variety of problems. In individuals with weakened immune systems, or diabetes, untreated nail fungus can increase the risk of bacterial infections of the surrounding skin. Nail changes. Untreated nail fungus can cause the nail to become thick, brittle, discolored, and distorted. The nail may also become crumbly, or even separate from the nail bed. Spread of infection. The fungus can spread to other nails, making it difficult to treat, and potentially leading to a more widespread infection. Secondary infections. In individuals with weakened immune systems, diabetes, or other conditions, nail fungus can increase the risk of bacterial infections of the surrounding skin. Pain and discomfort. As the infection progresses, the nail can become painful and make it difficult to wear shoes or perform everyday tasks. Potential for amputation. In severe cases, particularly in individuals with diabetes or other conditions, nail fungus can lead to serious complications, including cellulitis, osteomyelitis, tissue damage, and potentially even amputation. That wraps up our discussion on nail fungus. We should always remember important considerations. Fungal nail infections can be contagious and can spread from person to person or through contact with contaminated surfaces. Early diagnosis and treatment are crucial to prevent the progression of the infection and minimize complications. Maintaining good foot hygiene and keeping feet dry can help prevent the spread of fungal infections.